Hello, and welcome to this CTSNet Roundtable. Today we will be discussing a topic that is quite timely and something that's been on many of our minds: keeping your family and home safe during the COVID-19 pandemic. My name is Mara Antonoff, and I'm a general thoracic surgeon at MD Anderson Cancer Center in Houston. I'm joined by some outstanding guests today, and I'm confident that their insight will add immensely to this conversation. Before we get started, I'd like to ask each of the panelists to introduce themselves.
Hello, I'm Daniela Molina. I am a general thoracic surgeon at Memorial Sloan Kettering.
Hi, I'm Tom Wynn. I'm a cardiac surgeon in Houston, Texas, at the University of Texas and Memorial Hermann Hospital.
Hi, I'm Tamar Noble. I'm a fourth-year general surgery resident at Mount Sinai Hospital in New York City, and we also work at Elmhurst Hospital in Queens.
Terrific. Well, I want to thank you all very much for joining me today. As we talk about keeping our families and homes safe, we recognize that our viewers may have varying levels of clinical exposure to patients with coronavirus, both known and unknown, and a wide range of home environments. Certainly, even those who live alone will want to do everything that they can to keep their home a safe place. I'm wondering if we could each just take a moment to explain our home situation. I'll start. I live with my husband and 4 kids who range in age from 2 to 12 in a single family home in Houston.
I live in an apartment in New York City with my husband and my 2 kids. My daughter is 21, my son, we have 2 dogs.
I live in Houston, Texas in a condo with my wife. She's a radiologist, and my 18-month-old daughter. Because we both work, we also have 2 nannies that are kind of in and out of the house taking care of our daughter and our 3-year-old French bulldog.
I live with my boyfriend in a 1-bedroom apartment in New York City. It's a high-rise. We do have a lot of physicians in the building, but also a lot of elderly people. We also have a dog.
I'm wondering if we can each take an opportunity to talk about our routine in terms of our attire worn to the hospital. And I'm curious if you could each comment on whether your places of work have policies in place either supporting less formal attire, easier to wash attire at this time. I know that MD Anderson actually no longer allows men to wear neckties. But also, these policies can vary in different institutions. And I know many of us are trying to really wear the simplest clothing possible that we can wash in the hottest water as soon as feasible. So I'm wondering if you guys can each comment on your routines and how you're handling attire.
Yeah, so I'll start. So Memorial Sloan Kettering, we actually discourage necktie, as you said, at MD Anderson. We also don't allow those anymore. We're not allowed to use scrubs, so we can't go back and forth from work in scrubs, but we do use a less formal attire. Also, we have less opportunity to be face-to-face with colleagues and with patients, and so there is less need for formal attire. My routine, I use, like more sporty clothes. I walk to work. I'm lucky enough that I can walk to work. So I walk. First thing I do when I arrive at the hospital, I go to my locker room, I change in scrubs, and then I stay in scrubs for the remainder of the day and keep my clothes and my jacket and safe. I don't use a backpack anymore. I don't bring my computer to the hospital anymore. I leave everything at home. And at the end of the day, I go to the locker, change in my regular clothes after I wash and bathe in Purell, and then I walk back home.
How about you, Dr. Wynn?
So our hospital system is a little bit more flexible. One thing I'd also add is that I think in today's time, we should probably stop wearing the white coat. I think the white coat is a potential nidus for infection. I think it's also important what we wear as well as what we don't wear. I think it's important for us to take off jewelry and necklaces, wedding rings, smartwatches, earrings, etc. I don't wear makeup, but it is encouraged that for women to minimize the use of makeup, because a lot of the makeup can get on the PPEs. And nowadays, a lot of centers, including our center, is trying to re-sterilize the PPEs.
How about you, Dr. Noble?
I would similarly echo the sentiments about white coats. I've stopped wearing mine for a few weeks now as well. In addition to that, our policies at my hospital are a little bit more flexible. However, I don't wear scrubs into the hospital anymore, and I will wear more comfortable clothing and then change upon arriving, and then change back into those clean clothes to leave the hospital as well.
Yeah. My experience differs a little bit on what I do on different days of the week. I work in a setting where I'm at our main campus hospital 4 days a week, which is where my office is. but I also do 1 day a week off-site clinic. And so for me, when the days that I'm at our main campus, I have multiple different steps. I always joke about how I feel like Mr. Rogers with all my different clothing changes, but I leave my house in comfortable, easy to wash clothing. And then I go to my office, which is in a separate building that no patients are allowed in during this time. That's been regulated for several weeks now. And I go to my personal office where I change into clean scrubs. And then I go and I do all my patient care activities. And then I go to the OR locker room, change into another pair of clean scrubs before I go back to my office to put on my clothes to go home. And then as soon as I go home, even though those clothes that I'm wearing have probably only been worn for a couple of minutes, I race to get them into the laundry room and don't let any of my family members touch me. And I feel like there's several layers of protection when I go to main campus. But when I go to my clinic in Sugar Land, which is where I was today, it can be challenging because I basically go from my house straight into the workroom for the clinic. And so I've been leaving a white coat at that clinic for the purpose, and you're right, white coats aren't great. But ultimately, if I'm wearing scrubs that I'm going to end up, or some article of clothing that I'm going to bring back into my house, I want to cover it with something. So I don't know the right answers. In that situation, I'm leaving a clean white coat in that clinic, and I'm wearing clothing from my house and then covering it with the white coat and leaving the white coat there. And then as soon as I get home, immediately getting everything off of me, which, actually kind of goes into my next question that I wanted to ask you all. So when I came home today and I was wearing this clothing that I'd been wearing in the clinic, my 2-year-old and my 4-year-old came running. My 12-year-old and 10-year-old know to kind of stand back. But I'm wondering if you have any routines before you come into proximity with your loved ones and whether that can be hard for you. Dr. Milena, I'm assuming that your children are pretty compliant with understanding the importance of giving you space. But Dr. Nguyen, an 18-month-old, that can be really challenging, to kind of not have them come to you. And I'm sure for your wife, it's challenging as well, also being a physician. So wondering if you can comment about that, like how you keep space from your family during that routine when you come home.
Yeah, absolutely. I'm sorry. Go ahead, Danielle.
All right. I just want to say that I read all the stories on social media about how we all are handling things. And I really wish I had a house with a garage, because that seems the smartest thing to do. Go home with your car, change in the garage, and then go inside the house. And unfortunately, living in the city, we don't have that opportunity.
Right.
So I find that a little bit difficult. I think I'm also a lot more aware of what I touch, which I wasn't aware before. So I really try to, I don't touch the elevator buttons anymore. I try to use my elbows or some other, to stay as clean as possible. And thank God my kids are old enough that, when I go home, I just go right to the bathroom, change completely, take shower, and put the clothes to wash. And the only really, the dogs are the only one that comes and visit me. So those I have to be held back, but I don't have kids.
Right. Yeah.
So for me, I have an 18-month-old, and it's a little bit tricky because so for me, what I do is I try to sneak in without her seeing me. I was talking to my nurse practitioner earlier this morning, and she has the luxury of having a house like you, Mara. And what she does is she goes in the garage and will take her scrubs off and leave her scrubs in the garage. I run through the house without any clothes on, and their kids will ask, like, why is mom running around without any clothes on? Unfortunately, I live in a condo, so I don't have that luxury. So my routine is, I'll go to the hospital in my own personal clean scrubs. I'll change into the hospital scrubs in the hospital, and then put my personal scrubs in a bag somewhere. I'll go throughout my workday, and then when I'm done, I'll change back into the clean scrubs. I go to my car. I put my hospital clogs. I think is another kind of nice little trick. I'll put my dirty clogs in the car trunk inside a box. And then I put on non-hospital clogs. So I kind of designated kind of home clogs. I go home, I leave the hospital clogs outside the door, and I just go straight to the bathroom, and then put the clean scrubs, put my personal clean scrubs into a separate laundry bag that's separate from all the other clothes. And then I shower into regular clothes, and then I hang out with my 18-month-old daughter. So that's kind of my standard routine.
It's humorous to me as we talk about all the different housing situations that we have. I'm fortunate in that my house does have an attached garage, but there are a lot of homes in Houston that have either a carport or a garage that's not attached. And I've heard a lot of people joking, in the area where I live, where if you see someone streaking across a lawn, don't worry, it's a healthcare provider trying to keep their family safe, because there are a lot of people who have detached garages and are running around, their yards in their, in their brown underwear or whatever it may be. But, it's interesting. Dr. Molina, you mentioned more awareness of all the things you touch. I've even noticed when I was operating the other day, how much more cognizant I was of, I went to take my loupes out of my box to put them on my eyes, and even just the mindset of, oh gosh, I was just positioning the patient and I need to sanitize my hands again before I put my loupes on my eyes, because then so they're going to touch my face. I mean, all the different things that we do, or I'm used to, simple things like, whatever it may be, helping, get the patient positioned, and then you pick up your phone to check a text message. And I have just become hyper vigilant about really sanitizing my hands between every single thing that I touch. And we're fortunate in our day-to-day lives that we actually have access to hand sanitizer. And so, I mean, outside of our medical worlds, it can be hard to even find hand sanitizer to wash your hands every time you touch stuff, although we're more exposed in our job settings. Dr. Noble, you haven't gotten a chance to speak much about this. And what is kind of your routine in terms of decontaminating yourself so that you don't get your boyfriend infected from your situation?
So I guess it's a combination of kind of what's been discussed already. So when I come home, first of all, in the elevator, I do try to use my elbows. I recently was able to acquire a small Purell to carry with me, so I can now feel more comfortable with that. But and then I kind of take off my clothes in the doorway, once the door is closed, of course, and put them into a garbage bag that I've allocated next to my front door. And then before touching my boyfriend or my dog, I run through the apartment through to the bathroom basically and take a shower. And so that's kind of how we've been doing it. So my dog obviously doesn't really understand and wants to come touch me. I don't really know if it can, really spread that way, but just to be safe, I try to avoid touching them until that time. And I guess just, along that note, I do feel very grateful that, even though we're living in the city, that, I live in an apartment building with a doorman and not just with like a walk up that I, would have to be touching all sorts of knobs. And then furthermore that I have, a 2-room apartment, because, we can think about a lot of our patients that are living in much more crowded conditions and can't really have, take those same precautions.
Right.
How do you guys handle door handles? So, buttons are easy. You can use your elbows and your knuckles, but let's say if you have to grab a door handle, do you use your shirt and kind of, use it? What's your approach?
So if there is a Purell station next to it, I get some Purell in my hand, and the other hand, open the door, and then Purell my hands right away.
Right. I only use stairwells when I know where the hand sanitizer is located in near proximity. And if I find myself having to open a door that there isn't a hand sanitizer nearby, I refuse to touch anything else until afterward. I also think people are kind of being more polite and taking one for the team, where it's like if someone opens the door, you realize you've already touched it, so just hold it for everyone around you for a little while. Or I've been very careful to make sure if someone's quite a ways behind me, I stand there and hold it with my foot, just trying to minimize exposure for other people. But you never know which of these surfaces are problematic, which actually brings me to another question. I've heard people talking about how they sanitize every single thing that comes from the grocery store before it comes into their house. We're obviously trying to minimize our exposure to external places outside the hospital. I mean, we've got 6 people in our house and we need to do some grocery shopping. And my husband has been the one that's basically been designated to go to the store. But we have not sanitized stuff as it comes in the door. For non-perishable items, it's great if we can just put it on the shelf and ignore it for 48 hours. That's kind of been my approach. But we go through quite frequent gallons of milk in my house, and it hasn't occurred to me to sanitize them. I'm not sure what others' approaches have been. I'm curious to hear what you all are doing.
So I, first of all, we try to shop as little as possible. And that has been very hard because living in New York, we were used to just buy what we need to eat in the same day. And we really didn't go for big shopping. So when we go shopping and we come home, I usually just clean things that, are cleanable, vegetables or fruit and things like that. We wash it really thoroughly before using it. But I do wipe with some sanitizer solution the outside of cardboard boxes or containers that are laying around the house, just to make sure that there is nothing there that can be touched.
Yeah.
Daniela, when you go to the grocery store, Daniela, do you wear a mask and gloves or no?
Yeah, well, right now I've been, since, my family is in Italy, so I've been a lot more sensitive than most about this disease, and I've been using a mask for everything I do. I even force my kids to walk the dogs with a mask on, and I think that it's you do it for yourself, but you do it also for others. We don't know where
Correct.
this is coming from. There's a lot of asymptomatic carriers, and I wanted to make sure, that the kids are safe. But even if we, are exposed, because working in the hospital, I think we are at high risk to even having it and potentially
Right.
giving it to others. So I always use mask everywhere I go, and I use gloves when I go shopping and touching, the carts and so forth. I use gloves to open cardboard boxes that comes from Amazon,
Right.
just on the safe side. So
I kind of similar. So I'm kind of the designated person in my family to go to the grocery store. And the only thing I would add is I try to go during the non-peak hours when there's less
Right.
people at the store. So that's usually kind of later at night or earlier in the morning. I'll tend to wear gloves, and it's funny because about a couple weeks ago, before there was more of a wide recommendation to wear a mask, I would still wear a mask to the grocery store, and people were kind of really looking at me kind of weird, like maybe I had something. And then now almost everybody has a mask on,
Right.
and those who don't have a mask are like jealous that they don't have a mask. I have to admit,
Right. Right.
but I do wear masks and gloves whenever I can when I go to the grocery store. And I try to sanitize and clean things as much as I can, as much as possible.
Another strategy that we've been using is we have historically in the past gotten meal delivery service from HelloFresh, which what used to like routinely cancel the shipment week after week unless something good came up that I really wanted to try or I thought I had time to make the meal with our busy lives. But right now there's plenty of time to cook. And so we still have our weekly box coming from HelloFresh, and I've even been adding additional meals for that. So I feel like it's one box that has a lot of ingredients that probably been in the box, this refrigerated box, for probably at least a couple of days before it gets to us, which I'm hopeful is helpful. We've also talked about interesting strategies when it comes to takeout, the conversations you never thought you'd had. So I had heard from a non-medical friend that you shouldn't get takeout anything that you're not willing to reheat in the microwave. So then my husband and I had an elaborate discussion about could we have sushi or not have sushi. And I did some reading about it, and my thought was, because it is not acquired through ingestion, it's just an issue of if someone sneezed on the food and then you touch the food and touch your face, something of that sort. My thought is that if you have sushi that is prepackaged and you pick up the sushi with the chopsticks and put it straight in your mouth and don't actually touch the food, that it's probably pretty safe. But I don't know what other strategies have been. Dr. Noble, are you finding that you get takeout in this situation, or how have you approached it?
So I guess similar to you guys, I am wearing a mask when I go to the grocery store, and gloves. With respect to takeout, I guess I try to wipe down the outside of kind of the bag after it's been handed to me and wash my hands before I actually eat it. But because I haven't been as kind of wiping down the individual containers. But I guess, just trying to wash my hands kind of once I'm touching the external aspects.
Good. Well, I know you've been in the middle, really, of the epicenter of the coronavirus outbreak in the United States. And I'm curious, do you feel that practices need to be different when working in an environment with such a high penetration of COVID cases? Or does everyone on the panel feel that we should be using standard precautions in all healthcare settings at this time? What are your different perceptions? I'm really curious about your perspective being right in the middle of it all.
So I think that things have really kind of continue to evolve each week that we kind of go through this. And I think that, I think when I spoke to you about a week and a half, 2 weeks ago, and I was at Elmhurst, at that time, this was really kind of the epicenter. But in the meantime, at Mount Sinai and the main campus in Manhattan, it's really also our general surgery service has evolved into a essentially COVID service as well. So even the patient with the small bowel obstruction there is now also a COVID positive patient for the most part. And so I think that kind of the same precautions that I would take in, a hospital that's essentially completely full of it. It's now, I would say, Mount Sinai main campus is also similarly kind of overrun by it. And so I would just, really taking the same precautions, wearing an N95 with any clinical contact, just leaving the goggles on for, the day when I'm out and about on the floor is really how I've been approaching it.
Yeah, I assume everybody has it, and that's, I think, the best way to try to protect yourself. Unfortunately, we don't have N95 too many at our availability, so I use those with very much discretion. I've also added some changes, to my practice. Like I used to do bronchoscopies and before doing a lobectomy on everybody. And now I very, very rarely do a bronchoscopy, as is one of the highest risk procedure. I try to avoid that at all costs. And if I do a bronchoscopy or an esophagoscopy, then I would wear an N95 mask. So we are kind of lucky in Memorial Sloan Kettering because we've done a really good job in trying to contain the disease. So we're doing pretty well still. And now finally we are testing every patient that come from any electives operation. And that has helped a lot because I think there was a lot of anxiety among anesthesia and nurses within the operating room because there are stories, of the all operative staff being having gotten the disease from a patient that is asymptomatic. And we find, patients that are scheduled for surgery that are tested and are found positive, they would not have guessed they were.
Right. So I'm curious. Go ahead, Dr. Nguyen.
Sorry, Dr. Antonoff. So in Houston, we haven't seen the surge that New York has, but there have been some predictions that suggest that we might be the next New York or Seattle. And I guess one of your questions, Mara, is what kind of precautions should we be taking, and it should be different depending on our geography, our location. And I think we need to take wide precaution because by being lax about it is when we end up being like in New York or in Italy or whatnot. So I think it is important for us here in Houston to continue to be as aggressive as possible. And some of the other things that I've incorporated to my day-to-day is whenever possible, I try to use Apple Pay without using my credit card. And so I always ask, hey, you have Apple Pay? I think it's another important thing is if you have most people have phones, you can get a waterproof case on your phone. And that way you can really just kind of wipe it down really good and disinfect it. Some people have really kind of fancy phones, but our phones touch almost anything. Anything your hand touches, your phone has effectively touched. Right. I think kind of our bathroom routine, it sounds so obvious, but how you wash your hands and how you dry it is important. So kind of here's my approach. I'll wash my hands. I'll use my elbows to actually turn off the faucets. I'll have the paper towel ready. Usually it's an automatic dispenser. If it's not an automatic dispenser, I'll have it ready. I'll dry my hands, but I won't throw it away right away. And then I'll use that paper towel to open the door on my way out. And then I'll toss it in a trash can kind of on the way out. So that's kind of my routine with just basic hand washing. It sounds obvious, but sometimes it's right. Not so obvious. But.
Well, it's interesting. I think we're all sensitive to these things at different points in time. And when each of my 4 children was a newborn, I was very careful about being really obsessive about keeping everything clean and hand sanitizer all the time and all the routines that you mentioned when opening any door when you're carrying around a newborn. And then somehow when they get to be about 6 months and they're putting everything in their mouth, you kind of let all of those concerns kind of go out the window. And so I'm just trying to remind myself to treat everything as though I have a newborn in my arm, and it helps remind me to be extra cautious. I know our time is running short. There's another question I wanted to ask of all of you, and I think it's important, will be of interest to our viewers, is whether any of you have thought about having an alternative place to stay if you did become ill, or whether you would stay at home. I know that you all have loved ones at home, and this is a question that I think it's really interesting to think about. So I'm just curious what your various strategies are if that were to occur, that if you were to become ill.
So I actually had very long discussions with my husband and my kids when this all started, and I insisted that they left New York. I said, take the car and the kids and the dogs and just get out of here, because I knew things would have gotten really tough in New York. But they decided they want to stay close by in case I needed help, and they wanted to be here for me. So what we have decided to do is if I get sick, we would adopt isolation within the house. And so one of the room will be my room. We're lucky enough that every bedroom has a bathroom. And so we have, kind of a room that I could use and a bathroom next to it. And we use gloves and mask in every kind of interaction with the family members, and try to stay isolated in the room.
That's pretty similar to what we decided to do if something happened at our house as well. How about the rest of the panel?
I agree. We have fortunate to have more than one room, and we would just have one room as the isolation room. In the Texas Medical Center, Rice University has been kind enough to offer their campus to those healthcare workers who end up being COVID positive or need a place to stay. So that's another option as well that's on the back of our minds.
And what's being done for trainees? Are there special housing being offered for trainees, Dr. Noble?
So I guess having had several colleagues that have already kind of gotten COVID, I can comment on their experiences, and people who are also actively avoiding it because they have a partner who has a comorbidity. I think most of us live in maybe a 1-bedroom, and so kind of self-isolating, but on the couch, I guess, would be kind of the answer if you decide to stay at home. As you've all mentioned, I think that discussing this with your partner or roommate is really the most important thing, first of all. But then, other people might be lucky enough and have the second room, so same thing. I have one colleague that actually was staying in a co-op with a friend, and the co-op board kind of found out that he was working on the front lines and actually was asked to vacate the friend's apartment.
Wow.
So he's found another place to go. But our hospital is offering some options for trainees who would like to not be at home. I think it's in some of the medical school dorms. And then I know that there are several hotels in New York City. I think from what I've read online, it seems like it's difficult to get a room there. But
Right.
Oh, terrific.
It's interesting though, because when you live in a big building and a lot of people in the building, and it's important to know what the rules are. And so a lot of the buildings in your city have some specific rules that if somebody becomes positive, has to communicate that with the building manager so that the doormans or the building staff can help the person do whatever they need to do while they are isolated in their house. And they really check on the days from the infection to the time that you're allowed out again.
Right. And I live in a condo as well. And I think one of the riskiest places is the elevator, right? Because you really can't get 6 feet away. So I'm not sure what, your strategy is, Dr. Molina, but I don't know. I kind of, if there's a lot of people, I'll just wait for the next elevator and I kind of hold my breath a little bit as I'm in there. And hope for the best, right?
I mean, I live in the 17th floor, which are really just 16 floors because of 13 and it doesn't exist. And I can tell you that often I've gone up and down the steps, but I don't do that all the time.
I've started asking people for permission because I've noticed that some people will actually just get out of the elevator if they saw me getting on. So I've started to ask, is it okay if I join you?
Oh, no.
Good point.
That's very respectful of you. I think that's kind. So I know that this has been a really interesting discussion. I'm just wanting to know if anyone has any other closing thoughts or any other tips that you can share regarding keeping your families and homes safe during this really unprecedented time. You have such a wealth of experience, and I'd love to hear any further thoughts that any of you may have.
No, go ahead. After you.
All I was going to reiterate was that I think, as everyone has commented on, I think that just having a plan with the people at home that you live with is really important, and so that everyone's on the same page and take the precautions that are needed.
I think the one thing that comes up as healthcare providers is, what do we do if we're exposed to COVID positive patients? And, as we know, many patients, people who transmit the disease can be asymptomatic. So our approach has been to, if you're exposed or if you think you're exposed, to try to isolate as much as possible and even potentially wear a mask at home. Something else I think we do very routinely is we share our food. In the Asian culture, we share food a lot, but this time it's probably important not to share food, even separate bowls, plates, and utensils, as we wait to get through this.
Yeah, I really agree. I think communication is key. It gives us a totally new perspective, right, of what our job is like and how it can affect our own family. And but I think that try to remain isolated if you think you've been exposed to and you're high risk for a contact that you had, to isolate yourself from the family and try not to share much of things with them. It's important, and until you know that you're not sick with it.
Yeah. I agree with all the panelists. This has been a really fantastic discussion, and I can't thank you enough for making time to share your experiences with the audience. We wish everyone health and safety during this really challenging and unprecedented time.